Welcome to Moms Every Day. We're here now with Dr. Raj Khanna, and today we're talking about oral health. So I understand that you're an oral maxillofacial surgeon, and a lot of people probably have never heard of that. So explain a little bit about what you do.
Well, it's a tongue twister, oral maxillofacial surgery, but it's a little different. Oral surgery grew out as a field just by taking teeth out, shorter training times. But then the training got more than 2 years, so now we have oral maxillofacial surgery. So what that involves, not only taking teeth out, not only doing wisdom teeth, but also facial fractures, treating on your joints. You know, people have TMJ, things like that, oral cancer, facial cancer. Then it has advanced and branched out into facial aesthetics. So we cross into territories with dermatology, with ENT, so we can do facelifts, blepharoplasties. So the training has gotten involved, and that's why an MD got incorporated into oral maxillofacial surgery. Most oral surgeons do a 4-year training program after dental school, and then it's optional to get an MD with it, and then you go 6 years. So that's not a norm to have an MD, but it's encouraged. So that's what I did, and that's what I do at Cabell Huntington Hospital.
Okay, and what are the benefits of having your practice at the Marshall University School of Medicine?
Well, the benefits are numerous. Number one, we have the backing of the whole School of Medicine, so we can see a lot of sicker patients, a lot of unhealthy patients, which would be not suitable for a private practice. We are one of the specialties in the nation who have an anesthesia license, so we can knock people out in the office, we can sedate them, and it's always safe to have it in a hospital environment or a university setup where we have the backing of all kinds of specialists. So we can see a lot of compromised, sick patients who average oral surgeon or dentist would not be seeing in their office. So that's a big plus.
Now, what are some of the things that maybe you see that a normal oral surgeon may not see? You said some of the more complicated types. So
right, we see patients who are medically compromised. They have a lot of health issues, so it would be not very good to see them in a private practice.
Okay.
And a lot of practitioners will refer those patients to us so we can manage them. We see a lot of facial trauma, which is not the norm in our average practice on the outside. So we do a lot of complex facial fractures. We rebuild their faces. Then we see a lot of pathology, and we get the Edwards Comprehensive Cancer Center. So in collaboration with that, we see a lot of cancer patients. So that's why it's a little different than an average private practice on the outside.
Sure. And you know, I understand that you've been practicing since about 2002. So why did you expand? You've actually expanded your practice to include general dentistry. Why did you expand your practice?
Well, the reason we expanded the practice was because there's a big unmet need in the community for dental care. We have a lot of patients who are not receiving dental care, and there's a big unmet need, especially in eastern parts of West Virginia. So we started a residency program with that to help meet that unmet need, so we can train residents who would stay in the community, go out, populate those unserved areas, and help provide dental care in those areas. But that was the main reason, so that we could have more dental care to the community locally as well as throughout the state. So that involved into starting a residency, and that's what we have. It's called a general practice residency. So we take residents every year. It is not a requirement after dental school to go do a residency. You can go out, you have a dental license, you can practice outside in the community.
Okay.
But having this residency really helps train dentists coming out of dental schools to improve their horizons, to expand their horizons so they can deal with more sick patients, more patients who have a lot of health issues. As people live longer, they have more medical issues. So the dental school trains you, provides you enough training to be a dentist, but the hospital experience is lacking. So that's where expanding this clinic, adding dental services, and a residency makes a big difference.
Now, what types of services does Marshall Dentistry and the oral surgery offer?
Well, we offer the whole spectrum of services. So we offer general dentistry like any other dental practice out in the community. So they can get their fillings done, their cleanings, their root canals, teeth extractions. Having me there as an oral surgeon provides them that extra care right on the spot. Because if you've gone to your dentist and you needed your wisdom teeth out, you will have to go make an appointment with an oral surgeon.
Right.
So we incorporate that right there. Complex patients who are more compromised or who need sedation, we can provide it right there. So that's a little bit different than, again, your regular dental practice on the outside.
And how, you mentioned too,
provide care 24/7. We pride ourselves in providing you care 24/7 in collaboration with the emergency room at Cabell Hospital. We can see patients anytime.
All right. Well, Dr. Khanna, we appreciate you being here with us. If you'd like more information or like to get in touch with him, you can head over to WSAZ Mobile. Just click on Moms Every Day. Thanks for joining us.
Thank you.
Your morning commute can be a pain, but WSAZ has ways to help. Download the Waze app for your smartphone and become a part of the WSAZ Waze revolution. Join